In the brutal chaos of medieval battle, a sword or arrow wound could turn minutes into a matter of life or death. Soldiers were dragged from blood-soaked fields straight to the surgeon's table, fully conscious, where pain was treated not with anesthesia, but with strong wine, crude herbal sedatives, and raw nerve. Before antibiotics or germ theory, survival depended on moss-packed bandages, searing irons, and the extraordinary limits of the human body under stress. But how did so many endure surgery awake, and why did some live when infection was almost guaranteed? The answers begin where agony and ingenuity collided, the frontline triage that decided who would live long enough to face the knife. A wounded soldier, barely conscious, is hauled from the fray and laid out on rough earth. Blood soaks through the torn linen at his thigh. There is no time for deliberation. Every second lost to bleeding brings death closer. The first hands on him belong not to a surgeon, but to a fellow fighter or camp attendant. Their job is simple and urgent. Stop the blood. Pressure is applied, hard and unrelenting, with whatever is at hand, a folded cloak, a strip of shirt, or, if luck holds, a bundle of sphagnum moss. This moss pulled from nearby marshes is more than a makeshift sponge. Its natural acidity slows bacterial growth, a hidden advantage centuries before anyone understood microbes. Sometimes spiderwebs are pressed into the wound, their fine strands helping blood to clot, binding together with the body's own fibrin to form a fragile seal. The air is thick with the copper tang of blood and the distant roar of battle. There is shouting, orders barked, prayers muttered under breath. The wounded are triaged right where they fall. Some are lost before help arrives, but others, like this man, survive the first critical minutes because bleeding is controlled. The pressure never lets up. Hands grow slick, but the grip tightens. If the wound is deep or an artery hit, a crude tourniquet, often a leather belt or twisted strip of cloth, is cinched above the injury, buying precious minutes. A field attendant, perhaps a barber surgeon's apprentice, packs the wound with moss or lint, then wraps it tight with linen. The moss absorbs blood and limits surface infection. Wine or vinegar, if available, is poured over the dressing. The sting is sharp, but the alcohol helps kill some surface bacteria. Even without understanding why, medieval medics know that wounds rinsed with wine fare better than those left untouched. Once bleeding is slowed, the next ordeal begins. The wounded are lifted onto makeshift stretchers, doors wrenched from hinges, shields lashed together, or simply carried by hand. Every jolt sends fresh pain through the body. There is no morphine, only the hope of strong wine or herbal concoctions waiting in the tent ahead. The stretcher bearers move quickly, dodging mud and bodies, desperate to reach the relative safety of the camp surgeons. For many, this brutal rush from battlefield to tent is the difference between life and death. The simplest materials, moss, linen, pressure, become the first line of defense, holding back the tide until more drastic measures can be tried. In these frantic minutes, survival hinges not on advanced medicine, but on the speed of hands, the ingenuity of improvisation, and the body's own fight to endure. John Bradmore, a royal surgeon whose name survives in the records, faced a challenge that demanded both nerve and precision. His patient, Prince Henry, lay on the table with an arrowhead buried deep in his face, a wound that, untreated, would mean certain death. There was no anesthesia to dull the agony, only a strong draught of wine, and the hope that shock would numb the pain. Bradmore began by carefully widening the wound with a probe coated in rose honey. This was not reckless hacking, but a deliberate effort to avoid splintering bone or driving fragments deeper. Each movement was measured, with Bradmore watching for signs of fatal bleeding or sudden collapse. The probe traced the arrow's path, and when he finally reached the embedded iron, Bradmore used specially crafted tongs, designed to grip the arrowhead without shattering it. The extraction was slow, excruciating, and fully conscious. Honey played a quiet but vital role. Its sticky surface eased the instrument's passage, and its natural antibacterial properties guarded against infection in an age before germ theory. Once the arrowhead was freed, Bradmore resisted the urge to stitch the wound shut. Instead, he irrigated the cavity with wine and packed it with more honey, understanding, if only by experience, that premature closure trapped corruption inside. The next days demanded constant attention. Twice daily, Bradmore or his attendants would remove the old dressing, rinse the wound with wine, and repack it with fresh honey. The process was repeated for nearly 3 weeks. This careful, gentle approach allowed the wound to drain, reducing the risk of abscess or gangrene. Modern medicine now recognizes the wisdom behind these choices. Honey's high sugar content and acidity create an environment hostile to bacteria, while open drainage prevents the buildup of infectious pus. The prince's body, battered but young and strong, mounted its own defense. Fever threatened, but never overwhelmed him. Each day the wound closed a little more, granulation tissue forming where bone and flesh had been torn away. By the 20th day, the cavity had shrunk to a narrow channel, clean and free of foul odor. Bradmore's case stands as a testament to the skill and patience demanded of medieval surgeons. Survival was not a matter of luck alone. It depended on steady hands, knowledge passed down through generations, and the careful adaptation of natural remedies. Even in the chaos of war, there were moments of quiet method, where a surgeon's judgment and a patient's endurance together made the difference between life and death. Amputation on the medieval battlefield was not a last resort. It was often the only way to save a life when a limb was shattered by sword, mace, or cannon shot. The moment a surgeon decided to remove an arm or leg, everything depended on speed. Blood loss was the killer. Infection came later. The barber surgeon, sleeves rolled and hands already stained, reached for his tools, a knife for the skin, a bone saw, and a cautery iron heating in the coals. Assistants gripped the patient's torso and healthy limbs, pinning him down against writhing and thrashing. There was no ether, no chloroform, just a leather strap to bite and a deep draught of wine, if it could be spared. The first cut was swift and deep, slicing through skin and muscle in a single motion. Some surgeons favored a circular incision, others an oval, but all aimed to expose the bone as quickly as possible. Time was measured in heartbeats. The saw came next, its teeth grinding through bone with a sound that survivors never forgot. A strong assistant might twist the limb to snap the last stubborn fibers. The whole process, from first cut to severed limb, could be finished in under 2 minutes by a practiced hand. Delay meant death. Every second of hesitation allowed blood to pour from open vessels. To slow the bleeding, a tourniquet, a twisted belt, or length of rope was lashed tightly above the site. This crude device compressed arteries, buying precious moments for the surgeon to work. Once the limb was off, the real danger began. If a cautery iron was ready, it was pressed directly onto the open stump, searing flesh and vessels shut with a hiss and a cloud of smoke. The pain was blinding, but the alternative was worse: unchecked hemorrhage or slow poisoning by infection. Some surgeons in later centuries tied off arteries with silk or linen thread, but in most of the medieval period, burning was the standard. Tools were shared between patients, wiped on aprons, or rinsed in wine when time allowed. The risk of spreading infection was high, though no one yet understood the true cause. Even so, archaeological studies of skeletons from battlefields like Towton have revealed signs of bone remodeling, evidence that some amputees survived not just days but months or years after surgery. Healed stumps, with smooth new bone and no signs of chronic infection, tell a story of bodies adapting and wounds closing over time. Survival rates for battlefield amputations range from 25 to 50%, depending on the skill of the surgeon, the health of the patient, and sheer luck. The body's own immune defenses played a silent role, fighting off bacteria introduced by dirty blades and rough hands. In the absence of antibiotics, the difference between life and death was often decided in those first frantic minutes. The surgeon's speed, the tightness of a tourniquet, and the resilience of the human body under unimaginable pain. Survival came down to speed, skill, and sheer resolve. A battered soldier, barely able to speak, is handed a cup of wine as he is laid on the surgeon's table. The cup is not just for courage. Wine, with its sharp taste and burning after effect, serves a double purpose in the medieval surgeon's hands. At 10 to 15% alcohol, It dulls the edge of pain and kills some of the bacteria lurking on skin and in wounds. Rinsing a gash with wine is no gentle act. The sting is fierce, but the alternative is worse. Without any understanding of microbes, practitioners learned by hard experience that wounds cleaned with wine are less likely to fester. But wine alone cannot drown out the agony of the knife or the saw. For that, medieval medicine turns to the apothecary's shelf. The soporific sponge, a piece of cloth soaked in a potent brew of mandrake, opium poppy, and hemlock, offers a kind of chemical mercy. These ingredients, each with their own dangers, are boiled in wine or vinegar, then wrung out and held near the patient's nose or mouth. The fumes bring on drowsiness, sometimes a heavy sleep, sometimes only a day's stupor. Modern analysis shows that opium can reduce pain by half, while mandrake and hemlock sedate the body, though at the risk of paralysis or even death if the dose is wrong. Even so, the sponge rarely delivers true unconsciousness. Most patients remain aware, gripped by pain but slowed by the fog of drugs and drink. The surgeon works quickly. Bleeding must be stopped before the patient slips into shock. Here, the most controversial tool comes into play, the cautery iron. Heated until it glows red, the iron is pressed against the open wound. The searing pain is immediate, overwhelming, and unforgettable. Proponents, like Guy de Chauliac, argue that cautery is the surest way to seal blood vessels and purge the wound of corrupt humors. For battlefield surgeons, speed is everything. The cautery iron closes arteries in seconds, preventing fatal blood loss when every heartbeat counts. Yet the cost is high. The blast of pain can drive a patient into shock, their pulse racing, skin turning clammy as the body reels. Some surgeons, especially those trained in university medicine, criticize cauterization as brutal and destructive. They favor tying off vessels with silk threads, a method that avoids burning but takes more time and steady hands. On the battlefield, though, theory often yields to necessity. The cautery iron remains the tool of choice for most. Its scars a mark of survival and of the desperate measures taken to keep men alive. The debate between burning and binding will continue for centuries. For now, fire, wine, and herbs form the uneasy trinity of medieval pain control. Each offers some hope against agony and infection, but none can promise safety. The surgeon's choices are shaped by the chaos of war, the limits of knowledge, and the raw resilience of the human body under stress. The body's response to trauma set the foundation for survival long before the first dose of penicillin. In the chaos of battle, stress hormones flood the system. Adrenaline sharpens the senses, narrows blood vessels, and primes immune cells to swarm the site of injury. This natural surge buys precious minutes, slowing blood loss and dulling pain enough for wounded men to endure the surgeon's knife. Modern medicine now recognizes this as the acute stress response, a built-in defense that medieval caregivers relied on without knowing its name. Archaeological evidence reveals just how often the human body managed to recover. Skulls from medieval graveyards show clean-edged holes, signs of trepanation, a surgery where a section of bone was cut away to relieve pressure or remove debris. Remarkably, up to 90% of these cases show new bone growth along the margins, clear proof that patients survived not just days, but months or years after the operation. The story repeats in the bones of amputees. Healed stumps with smooth, remodeled edges tell of bodies that closed wounds and fought off infection, even after crude surgery. Written records from hospitals run by the Knights Hospitaller add another layer. Infirmary registers from the 12th to the 14th centuries document hundreds of cases of soldiers treated for wounds, fractures, and amputations. Survival rates ranged from 40 to 60%, a testament to both the skill of caregivers and the resilience of their patients. Without antibiotics or modern antiseptics, these outcomes depended on meticulous wound cleaning, repeated dressings, and the body's own immune defenses. The evidence, preserved in bone and parchment, reveals a hidden strength, the ability to heal under conditions that seem impossible by today's standards. In the summer of 1536, Ambroise Paré, a young French surgeon, found himself at the siege of Turin, tending to men torn open by gunshot wounds. Custom dictated a brutal remedy, boiling oil poured directly into each wound. meant to cauterize and purge imagined poisons. That day, the supply of oil ran out. Faced with a choice, Pear improvised. He mixed a balm of egg yolk, rose oil, and turpentine, then dressed the wounds of those left untreated by oil. The difference was immediate and striking. By morning, the soldiers who had received Pear's gentler balm rested quietly, their wounds calm and free of swelling. Those scorched by oil tossed in agony, feverish and inflamed. Pear realized what tradition had masked. Burning flesh did not save lives. It destroyed tissue, drove pain to its limits, and often led to death by shock or infection. The balm, though simple, allowed the body to begin healing on its own. Turpentine, now known for its mild antiseptic qualities, helped keep wounds clean. Egg yolk and rose oil soothed raw tissue, reducing inflammation. Pear later wrote that he dressed him, God healed him, which captured his new respect for the body's own powers of recovery. He abandoned boiling oil and, in time, replaced cautery with ligature, tying off blood vessels with silk thread. This method, tested on the battlefield and guided by observation, slashed mortality rates for amputations and gunshot wounds. Pear's innovation did not come from theory, but from watching men live or die. In a world without antibiotics or anesthesia, the lesson was clear. Sometimes the gentlest hand is the most effective weapon against death. Today, every surgical advance, from sterile gloves to anesthetic gas, rests on centuries of adaptation born from necessity. Medieval practitioners, working without antibiotics or anesthesia, forced medicine to confront the limits of pain, infection, and human endurance. That legacy shapes how we respond to new threats, such as antibiotic resistance, trauma care, and even battlefield wounds. Survival still depends on adaptation, and on the lessons pain has never let us forget. Share your thoughts below.